learned some new stuff today. I hope you did too. But welcome everyone back to the third and final session of the Whole Person Care webinar series on advancing cardiovascular and endothelial health through risk panel testing and evidence-based strategies. Okay, next slide. I am, again, Dr. Holly Lucille, licensed naturopathic doc and also senior medical advisor at Fullscript. And I'm thrilled to close out this series with the session, Streamlining Whole Person Care, Clinical Tools for Vascular Health and Inflammation. And so before we dive in, again, first session, Dr. Winchester, Senior Manager of Clinical Education, thank you so much. This is what we covered so far. Discuss key inflammatory markers for cardiovascular health. And also just this last session, Dr. Carullo, Senior Manager of Medical Information and Safety at Metagenics, highlighting the function and role of specialized pro-resolving, I should say, mediators or SPMs in resolving vascular inflammation. And again, don't worry if you miss anything. This will all be recorded and sent to you, or you can go to fullscript.com/webinars. All right, next slide. Whoops, I just ruined that. Excuse me. Okay, in this last session, we'll explore practical clinical tools to help streamline whole person care, providing you with actionable strategies to support your patient's vascular health and inflammation. And before we begin, again, submit any questions in the chat and we'll try to get to as many as possible. And the webinar is being recorded, you know that, and also a copy of the presentation slides are available right now for download in the files section of this platform. All right, next slide. And again, a quick reminder for all of these that the presentation is intended solely for the education of healthcare providers and certainly not meant to provide medical or professional advice. All right, next slide. So let's explore the whole person care template for endothelial and antioxidant support on Fullscript. But what are exactly templates? Let's take that up first. Think of them as structured evidence-based resources designed to streamline your workflow. And they are developed all by Fullscript's medical advisory team, and they provide curated recommendations for lab testing, supplements, and also lifestyle interventions, all in one convenient place. So these tools aren't rigid. Instead, they're quite adaptable frameworks that can be customized to fit each person's and your patient's specific needs and health objectives. Next slide. All right, so our first session was with Weston. Let's start with labs then. So the metabolic risk panel includes total cholesterol, HDL triglycerides, non-HDL cholesterol, and ApoB, a key measure of atherogenic lipoproteins. And it also includes glucose metabolism, markers like hemoglobin A1C, insulin, and C-peptide to assess insulin resistance, which of course is a major driver of cardiometabolic disease. So then fatty acid balance also plays a significant role in inflammation and cardiovascular health. So the omega check measures key omega-6 and omega-3 fatty acids, including linolenic acid, arachidonic acid, EPA, DHA, all helping to assess overall metabolic and inflammatory status. And then nitric oxide is essential for vascular function. And ADMA and SDMA impact its availability. So elevated ADMA directly blocks endothelial nitric oxide synthase, or otherwise known as little e NOS, which inhibits NO production, and SDMA indirectly blocks NO production by inhibiting the availability of free L-arginine. And then chronic inflammation and oxidative stress are key drivers of vascular dysfunction. We know this. So that highly sensitive CRP is a well-established predictor of cardiovascular events. And a study showed that reducing inflammation, even without lowering LDL cholesterol, can reduce cardiovascular risk factors. And homocysteine, again, another critical marker with elevated levels linked to endothelial dysfunction and cardiovascular disease. And lastly, F2 isoprostanes are markers of oxidative stress with high levels associated with smoking, cholesterolemia, diabetes, and obesity, all of which contribute to chronic disease progression. All right, next slide. Next, we have two vascular-specific inflammatory markers which provide further insights into cardiovascular risk. L-little p, I should say, PLA2 is an enzyme linked to macrophage activation in atherosclerotic lesions, indicating increased coronary artery disease risk. And then MO, released by white blood cells, this is just a callback from earlier today, in response to plaque vulnerability, is associated with an elevated risk of cardiovascular events. So important to understand those two. And then oxidized LDL reflects oxidative damage to LDL particles. And obviously, those LDL very easily oxidized. Individuals with elevated levels are 3.5 times more likely to develop metabolic syndrome within 5 years, highlighting its role in early disease detection. And then, as well, micronutrient deficiencies can also contribute to cardiovascular risk. That's why it's important the B vitamin panel measures B1 through B12. Vitamins like B6, B12, and folate are particularly important for maintaining homocysteine balance, with deficiencies linked to increased cardiovascular disease risks. And lastly, nitric oxide plays a crucial role in vascular function. So, nitric oxide and oral microbiome test strips measure salivary nitric biomarkers, offering insight into nitric oxide availability and prebiotic nitrate levels, which are essential, not often thought about though, for cardiovascular health, the oral part, that is. All right, next slide. So then, now that we've covered labs, all right, and labs, I think, a little bit more robust than just that lipid panel, let's move on to evidence-based ingredients that support vascular and endothelial health. So we'll start with these specialized pro-resolving mediators. Dr. Crullo did an amazing job and covered this in detail, but a quick recap. SPMs are derived from omega-3 fatty acids. They accelerate inflammation resolution and enhance immune function and promote tissue repair. Check. I love it. So let's look at a few additional evidence-based ingredients. Those anthocyanins. These are plant compounds responsible for those red, purple, and blue hues in fruit and vegetables. They help decrease inflammatory markers, enhance antioxidant activity, and support endothelial function by improving blood vessel responsiveness and reducing proatherosclerotic activity. Then there's the good coenzyme Q10, otherwise known as what? Ubiquinone. It is in each and every cell in our body, which is a fat-soluble nutrient, plays a key role in free radical scavenging. And also, it has been shown to reduce inflammatory markers, boost total antioxidant capacity, and lower oxidative stress. Vitamin B9, folate. This is a water-soluble B vitamin supporting endothelial function by reducing oxidative stress, inflammation, blood pressure, cholesterol, and homocysteine levels, while also improving glycemic control. Then there's green seaweed extract. It's been shown to restore endothelial glycocalyx integrity and reduce total plaque burden and maximum plaque thickness. And then our good old EPA and DHAs. These essential fatty acids support cardiovascular health by reducing atherosclerotic progression, lowering triglycerides, decreasing inflammation, and improving endothelial function. And then finally, good old vitamin C. I love it. A potent antioxidant with anti-inflammatory properties, which has been shown actually to improve endothelial function. We don't often I don't think about vitamin C in this category. All right, next slide. So we'll wrap up the template with this whole person care, right? We've got to have dietary and lifestyle recommendations to support our clinical cases today of vascular health and endothelial function. So first of all, Mediterranean diet in the data supports weight management, glucose control, lipid balance, and inflammation reduction. There's also nitrate-rich foods, which enhance nitric oxide bioavailability, vasodilation, and endothelial function with anti-inflammatory benefits. Sulfur-rich foods improve nitric oxide production, circulation, and blood pressure regulation, also providing antioxidant support. And then polyphenolic compounds boost that NO production again, circulation, and platelet regulation with anti-inflammatory and antioxidant properties. So these dietary strategies can also help maintain vascular integrity and long-term cardiometabolic health. So yes, labs, yes, supplements, but these other pieces of dietary interventions, lifestyle modifications are super important. Next slide. We've attached to the template patient resources created by our medical advisory team to help support dietary changes. Next slide. And building on dietary strategies, oral health and movement further support vascular function and cardiometabolic health. So again, as I said, often overlooked, the oral microbiome, we're still getting, I think, used to assessing this and bringing it into the forefront in a condition like this, plays an important role in vascular function. And one study, in fact, found that a specific bacterial strain is not only more abundant in stroke patients, but it is linked to a 20% increase in stroke risk. And interestingly, a second study found that flossing, a simple and cost-effective oral hygiene practice, lower stroke risk independently of brushing and dental visits, just flossing by itself. And another reason to consider the health of the oral microbiome is its ability to convert dietary nitrates to which are then further reduced to nitric oxide in the body. Fascinating. And then, of course, promoting exercise is vital for our patients with cardiovascular concerns. Physical activity enhances insulin sensitivity, cardiovascular function, weight management, and also metabolism. All right, let's go to the next slide. So here are some patient resources for the lifestyle recommendation we discussed. And as I mentioned, these resources are attached to the template, right? So however, you can find them in the resource section of your account. You can also access them by downloading the slide deck and clicking on the links. Next slide. So now that we reviewed this particular protocol template, let's walk through how to find it within your Fullscript account. In fact, I encourage you all to just log in if you haven't already, so you can follow along step by step. So I'll just take a quick beat and allow you to do that. Logging into your Fullscript account should be pretty seamless. All right, we'll go to the next slide. So once you are logged in, you'll land on your homepage, obviously, right? And so to access templates, just navigate to the left-hand menu bar and click on Catalog. So a drop-down menu will appear, and then from that drop-down menu, you can select templates from the list. Next slide. And then inside that template library, you can use the search bar to find a specific template by entering just keywords. It'll pop right up. And then you also have filter options, such as sorting by owner, whether it's a Fullscript created template or one that you've personally built yourself. You can also organize templates by newest or by health category. And if you're looking for Fullscript's latest protocols, simply scroll to the bottom of the page. All right, so now let's navigate to the whole person care, endothelial, and antioxidant support protocol, the one that we're focusing on today. Next slide. So once you can pull that particular protocol up, or template up, I should say, clicking on the template takes you to the preview page, where you'll find a list of diagnostic tests, included in the protocol, along with corresponding products for the ingredients discussed earlier and all available patient resources. They're going to be all right there. Next slide. So switch to the evidence tab, okay, to explore all the ingredients and lifestyle recommendations included in the protocol. And you'll find recommended dosing and supporting research for each and every ingredient. This is just a condensed overview, and viewing it in your account will provide additional details. So let's move forward and start building your plan. Next slide. So when you click Build Plan, you'll enter the treatment planning tool. And this is where you can customize this template, all right, and any other one that you pull up. So at the top, you'll see a list of diagnostic tests, and you can keep or remove them as needed. You've already have some of that data and you don't need it, you can just remove it. If there's something there you're like, I haven't thought about, that's a great point, then keep it. And below that, you'll find the products featured in the template. And you have full control here as well. You can remove products, you can adjust dosages, you can add notes, or even introduce new products that weren't originally included. And then at the bottom, you'll find patient resources such as handouts, and you can choose which ones to include or remove any that aren't relevant, or upload your own resources that you have already to further support patient education and adherence. And this flexibility about how customizable this is allows you to tailor the plan to your patient's unique needs while reinforcing health literacy and behavioral change. Next slide. So once the plan is finalized, your patient will receive a notification. And if they have the Fullscript mobile app, the treatment plan will be accessible directly on their device. And from there, they can select the products they'd like to purchase and add them to their My Currently Taking section, which acts as a personal supplement tracker. And patients can also set up auto refill for any supplements they choose, ensuring that they'll never run out and can stay on track with their regimen. This is such a great compliance hack, in my opinion. My patients love this. This feature, along with dosing reminders, helps support adherence and long-term wellness. And with that, basically completed our walkthrough. So next slide. Thank you so much. All right, we're going to we have a couple minutes here. So I'll go to Q&A and I will ask a question here. Okay. Where can I find the Fullscript template in my account? And can I build my own templates? Yep, just went over that. So to find the Fullscript template, again, navigate to the plans or the catalog section, then The drop-down menu will appear. You can select templates, and in the template library, you can scroll all the way down made by Fullscript section, and then you can create templates from scratch from the template library or using existing Fullscript templates as a foundation. So they'll be all right there. Again, plans or the catalog section, the drop-down menu templates, and then you can use that search bar and keywords. And then, okay, where can I find patient resources and can I add them to my templates? Absolutely. So to find the patient resource library, simply navigate to the catalog section in the Fullscript platform. A drop-down menu will appear and select resources. And then for Fullscript produce patient resources, scroll down to the Fullscript patient resources section. And again, you can also upload things that you have in your practice already. You can upload your own patient resources here, making it super easy to add them directly to the treatment plan. You just attach them and template, and incredible for a streamlined patient education and engagement. All right. I just want to close out by thanking each and every one of you for being with us today for this last 90 minutes. And again, if you're looking for more information or questions, you can always email support@fullscript.com if the question is about your account. Or if you have questions about this presentation, you can contact education@fullscript.com. Okay. Thank you so much again for attending, and we are going to see you next time.